Next sliding. Slide shift. You all can maintain the silence. Om Shri Manjunathaya Namah. Good afternoon to everyone, offline and online viewers. Very happy to present the post-lunch session, that is yoga and naturopathy based lifestyle intervention for type 2 diabetes mellitus, a randomized parallel group trial. My great pranams to Dr. Virendra Hegde, Dharmadhikari Shikshetra Dharmasthala, developing such a beautiful institute more than 35 years back in the form of hospital, and 32 years back, 33 years back, the college. So, great pranams to him and mainly to our principal and a principal investigator. By seeking his permission, he was a principal investigator in this diabetes also. I'm a co-investigator of the project. So I'm happy to present the third presentation on COE. The first presentation in 2019 conference I presented here. 20 January, all the three modules I presented in Yashvyasa conference at Ecofera at Bangalore. So this is the third time I'm presenting on Center of Excellence project, its module and its efficacy. The entire theme today in the discussion is regarding the role of yoga and naturopathy, efficacy of naturopathy treatment for diabetes mellitus. So these are the contents of the study. We are going to learn about the introduction, materials and methods, how the study conducted, what is the study design, study duration, inclusion and exclusion criteria, yoga protocol and its mechanism, treatment protocol and its mechanism, diet protocol and its mechanism. We are in the process of analyzing the result, but in conclusion I want to interpret about overall view, not the actual result. So as the introductory part, you all know it is a metabolic disorder. The metabolic disorder means it is a disorder character, because I have to do a little introduction about what is diabetes mellitus. There is usually when diabetes mellitus case comes, means there is hyperglycemia, increased blood glucose level due to insensitivity or deficiency of the insulin secretion. Anything can happen. There will be normal insulin secretion, but cells will not uptake the glucose. That's called as insulin resistance. There may be chances of insulin is non-potent itself, or cells may reject. So why it is a lifestyle related disorders? Why it is a diabetes mellitus is a lifestyle related disorder? various factors. Maybe the stress factor, because person is exposed continuously to stress and tension, cells will not accept. For example, if I lock all the one room, I lock and I tell you to enter, it is not possible. Similarly, cells to accept the insulin. Because as my base of my clinical experience, I am telling, stress plays a major role. It's a lifestyle related disorder. Wrong lifestyle is a major problem for diabetes mellitus. Because people are working continuously with the stress and tension, they are subjected to tension, stress, wrong lifestyle, will not, the glucose level will go up. As soon as they change their lifestyle, practice yoga, moderate their lifestyle, moderate their diet, slowly their diabetic level will come down. Sometimes there is a drastic changes. I have seen some cases which is more than 330 ppbs after food 1-2 hours, more than 250 fasting blood sugar. Normally it will be around 110, and there will be 140. See, what happened is that they continuously, the moment third day itself, it will come down. Many times I shared this experience to my students also. So this is lifestyle change, stress reduction. So these are all plays a very important role in diabetes mellitus. So that's why we can say International Federation says in 2017 there are 424 million adults between 20 to 79 years age with diabetes. But they expect that in 2045, after another 23 years, it will be 628.6 billion. See how the doubles the people who are suffering from this particular disease. That we have to be. So that in that India is the largest contributor for regional mortality due to diabetes, with an estimated 1 million deaths in 2017. So maybe along with diabetes, even cardiac disorder also plays. Morning there is a presentation by Dr. Raghavendra Swami about entirely how stress affects on cardiovascular disorder, and another the great scholar will present next, Dr. C.N. particularly on lifestyle related and cardiovascular disorders. So, then what is the cause for this? They said urbanization is the cause, altered lifestyle is the cause, binge eating is the cause, low physical activity. So many people, their physical activity is nil. Maybe today we are seeing some awareness is developing, people are walking, but only what not increase the decrease of blood sugar and control the diabetes. But that is also one cause. Inactivity or physical inactivity, stressors, what I told now, aging factor also counts. So when we diagnose and when we treat a diabetes case, we must aware about all these factors. Then only you become a very perfect clinician tomorrow. So that's why it's very important to know about it. Its prevalences, rise in prevalence of type 2 diabetes mellitus, mainly type 2 diabetes mellitus, which is what our topic of our CO Center of Excellence, type 2 diabetes mellitus. So what is the interest? The current study to effect the integrated naturopathy and yogic lifestyle. See, this was an interest from our area by our principal and our team, that okay, 10 days patients will admit here, they will take a treatment, what type of effect they will get? Third month, what type of effect they will get? 6 months, what they go back. Naturopathy and yoga, whether it is going to their house level, home level, and whether they are able to get an awareness after 10 days in naturopathy and yoga treatment. That was our aim while conducting the study and objective of our study. Development of cardiovascular risk also we have seen. On also glycemic control, whether it will affect on both cardiovascular risk as well as glycemic control. I think in normal research what happens, I think that will cover. In our hospital, duration was 3 years. There are 2 phases. One phase was intensive phase. Patient must admit in the hospital and undergoing the treatment. Another is continuous phase. After 1 month, 10 days to come for up to 9 months in 3 consecutive months, 3rd, 6th and 9th month. And the design was prospective randomized parallel group trial. So this is our screening method. Based on baseline methods, you can see test group was 115, control group was 115. 11th day, 90th day, 180th day, 270th day. We have taken there all what are the parameters I am going to discuss in the next slide. and then data analysis and interpreted they were under all these things, standard oral hypoglycemic therapy, standard treatment of naturopathy and yoga. So, as I told now what we did, 11th day, 90th day, 180th day, 270th day. We have taken their study, 10 days we have given intensive naturopathy yoga intervention. Then we give them a very good follow-up with the diet chart, with yoga chart, with physical activity chart, and they are supposed to maintain the checklist. They are supposed to come at the 90th, 30th day, and the 30th day. Again we check them whether they have followed or not, then 60th day, then 90th day, and 180 days and 270 days. 9 months long follow-up with all the pre-assessments and in-between assessments in different periods. So, this was the inclusion criteria. As per the American Diabetes Association of Diabetes, we have the age factor is between 25 to 65 years. And they are only on oral anti-diabetic therapy. So exclusion criteria was individual with a coronary artery disease or any organic disease, we have excluded them. Type 2 diabetes mellitus individuals who are in insulin therapy also avoided, excluded. Individuals with a thyroid disease may hormonal imbalance may intervene. So that's why we avoided that also. And even the acute illness also avoided. These are all the assessments we made. That is height, weight, body mass index. You should know what are the things are going on. Maybe first year may be new for you. Or the people who are outside our institute may be new for you. What assessments we have taken in our Center of Excellence project. Body mass index, waist hip ratio, skin fold thickness, body fat analyzer, blood pressure measurements objectively, then heart rate variability. It is very important to know whether sympathetic and parasympathetic assessments. Stressor will give parasympathetic dominance, whereas when a person relaxes, maybe the paper I am going to present, earlier studies. When we prepared a module, we had an earlier studies. We have assessed the earlier studies. We have conducted assessment on earlier studies. Whether it is stress people sympathetic assessment or as in a people who are practicing yoga by a parasympathetic dominance, these were assessed. Quality of life and cardiovascular risk assessments. And biochemical you can see fasting blood glucose level, then hemoglobin, that is glycosylated hemoglobin, HbA1c, extended lipid profile, fasting insulin, postprandial blood glucose level, insulin resistance also assessed, inflammatory markers, pro-oxidants, antioxidant markers, they were all assessed. So this was our protocol. See, when we prepared a protocol, we had a lot of research with our own because with the help of my postgraduates, students, interns, as well as my colleagues, we were able to do some studies, earlier studies. So when earlier studies had proved that, according to that, I think the diabetic protocol is already published in a journal. Diabetic protocol is published. So this is the method we made. You can see in the slide different types of like loosening exercises, kriyas, normally jalaneti, sutraneti, vamanadoti, then all the loosening exercises and then different practices which commonly we give in a diabetic patient. See, many times they prescribe a treatment, whether it is model is justified, whether this model is having a scientific evidences. That was our first year review on Center of Excellence project that prepare a module under the background of the study. Whether such studies are conducted, whether it is proved that for insulin resistance decreasing, insulin sensitivity increasing, such asanas and such pranayama played any role. That was our big question. That was answered by a literature review and assessing about the modules. Like for example, we usually prescribe Trikonasana, Ardhakati Chakrasana, Parivarta Trikonasana. That was our module to know Uttita Padasana, Sarvangasana, Matsyasana, how many rounds, how many times, how many minutes, everything assessed here. Then in quick relaxation technique, prone series of asanas. The clinical evidence is very important in any research. So for example, you prescribe this module. When you prescribe this module for a treatment, people, the scientific world will ask a question whether this module is scientifically evaluated. So scientific evaluation done on this, and we made it a proper protocol on Vajrasana, Vakrasana, Ardhamasyendrasana and Paschimottanasana, deep relaxation, different pranayamas. A group of pranayamas, Bastrika, Suryanoma, these were normally prescribed during our diabetic protocol when we are giving. Sheetali, Sheetkari, Sadanta, Brahmari, different like 50 strokes of Bastrika, 10 rounds of about 4 minutes. The duration is also given here. So, as I told now, whether any study cut earlier, you can see from 2008 we started searching the paper, 93 paper, 2008 paper. Here there is an evidence. There is one study we have come across published in British Medical Journal that is complementary and alternative medicine 2008. Exercise therapy and lipid profile and oxidative stress indicators in type 2 diabetes mellitus. You can make that all these things, inflammation, the markers which is mainly oxidative stress markers, indicators were all better when you practice Hatha Yoga, because you all study Hatha Yoga. Student community can know very well about it. Asanas, Hatha Yogic exercises means it includes Kriyas, Asanas, Pranayama, Bandha, Mudra, and lastly the meditation or the Samadhi technique explained in Hatha Yoga. But Hatha Yogic exercises means mainly the Asanas. Asanas part of the Hatha Yoga. When they proved that when they compared with the physical therapies, these Hatha Yogic exercises are very good as a preventive and protective effect on diabetes mellitus. How? By decreasing the oxidative stress as well as improving antioxidant status. These two are very important considered study on diabetes mellitus patients. Similarly, they have conducted a percentage of study on yoga and traditional physical exercises. There is a two form exercise will be there. Traditional physical exercises known as a vyayama. It compares traditional physical exercises and yoga and on hormone and percentage insulin binding receptors in patients with type 2 diabetes mellitus. The American Journal of Biotechnology and Biochemistry in 2008 that paper is published. It is demonstrated that fasting glucose, oxidative stress markers, everything is improved, because this is clearly shows that diabetes patients yogic asanas are pretty, in compared with the physical exercises, effective tool. So another very important study we have found about pranayama. Pranayama, yogasanas on blood glucose and lipid profile in type 2 diabetes. Indian Journal of Clinical Biochemistry. So here they are going to, usually we use the word rejuvenating of the pancreatic cell. Beta cells of islets of Langerhans is responsible for secreting insulin. So that is rejuvenated by this process. So here insulin resistance is, sensitivity is increased, insulin resistance is decreased, and even receptor increasing the number of receptors increased after the yogic intervention, and yogic intervention is also effective to reduce the oxidative stress. So n number of module formation, we have studied many studies and we have found a very beautiful module which can become one of the clinical evidence based traditional based yogic practices. That was our intention to make it as a module and form a proper therapy module for diabetes mellitus. So similarly, so many studies were assessed on this. So how yoga works? This is a big question. We have referred more than 1,000 papers on diabetes, but we have the conclusion how yoga works in a diabetes patient. When you give a yogic module, when you give a module of yoga therapy, there are two ways you can see here. One is parasympathetic activation. So when parasympathetic activation occurs, means there is a reduced inflammatory cytokines and reduced heart rate and blood pressure. And when parasympathetic activation, there is a enhanced metabolic and psychological profiles, increased insulin sensitivity, increased glucose tolerance, improved lipid profile, and improved mood, depression. Everything is reduced. This is one way where parasympathetic, you can see parasympathetic activation occurs by practicing yoga. In another way, because the perception of the stress, yoga practice will reduce the stress perception. There is a reduced activation of sympathoadrenal system and HP axis. We are well aware that stress plays a role to prepare our system to face flight or fight mechanism. But what happens is that when a person is exposed to stress, it will become in a high mode. That will be reduced a lot when you practice yoga. And that is the reason where even oxidative stress is also reduced, improved endothelial function also. This is based on the study on the ancient science of yoga for diabetes. So, the reference is SYNC-BP. They were all given the study. So psychoneuro, endocrino immunomechanism of action of yoga in type 2 diabetes mellitus. So this is about yogic form. So our intervention was yoga and naturopathy. So you all know at the base of the naturopathy, it is based on Panchamahabhuta theory as well as removing the toxins from the body. So this is a base where we try to incorporate the Panchamahabhuta theories of the naturopathy. So with that we mean Jala therapy, hydrotherapy. Only that base is not enough when we treat a diabetes mellitus. So that's why evidence-based protocols are made on diabetes well. On these all, the 10 days what type of treatment we will give in our center. What type of follow-up we can give them in another 9 months, 8 months or 8 months, 20 days in their home. That was our aim. So we made all these like our, usually whatever naturopathy treatment we are giving like steam bath, sauna bath, full body massage or partial massages, different type, full mud bath. All these things were given. Along with that, the evening treatment was cold dip bath, GH pad, such type of our cold immersion bath. These are all given. Along with that, cold abdominal pack as a night treatment, which they can follow in home also. Continuously is given for 10 days, specifically for all 115 patients when they admitted in the as an experimental group in 10 days. So what is the evidence behind it? So we are prescribing okay. The evidence is here. When we give steam bath, when a person goes to heat, it modulates the glucose metabolism. The study was conducted in 2018. When we expose to heat, there is a increased sensitivity. So there is a balance between sympathetic and parasympathetic occurs. We always call it homeostasis. Homeostasis is a mechanism in our body. So when you take these heating treatments, heat exposure, if there is a diabetes because of stress and increased sympathetic dominance, that is balanced. And even another study on steam bath and sauna bath and fasting blood glucose level in healthy individuals that was published in Indian Journal of Biochemistry in 2018. So there also they found that after giving these two treatments, there is a significant reduction in the fasting blood glucose level. Even the passive heating on heat shock protein 70 and interleukin 6, a possible treatment tool for metabolic disorders that was published in 2007. Here also they found that for chronic inflammation and reducing the insulin signaling and development of the interleukin 6, that is, there is a more indicate that better prognosis. The prognosis part is also important, but these treatment, passive heat therapies are very good for recovering and treating and coming back. This is a rejuvenative period of patient suffering from diabetes mellitus. And normally we give cold dip bath. This is a very common treatment in ancient naturopathy also follows. A lot of questions comes when I am studying a student like student community. Why they give everyday dip bath diabetic patient? Here there is an evidence proved by our own alumni Dr. Mohandan. When he was doing his PG, he has conducted a study, diabetes and metabolism 2019, doubling the metabolic rate. That is TRP M8 activation, that is heat sensor, that is affected. So that's why they found that it is one of the very good practice, cold dip bath for parasympathetic dominance, as well as exposure to cold for 14 to 15 degrees centigrade induces a 43% increase in insulin sensitivity. So that's why there may be a lot of people that ask why they give dip bath, only it increases the blood circulation to the pancreas. Not so. Even parasympathetic dominance occurs. Along with that, 43% increase in the insulin sensitivity. So similarly, when we give different naturopathic treatments, like as I told now, cold dip bath when we give, emphasis on naturopathic management of type 2 diabetes. Rukmini and Nair in 2016 she published a paper. There is a contraction of the muscles, there is activation of that particular gland, particularly the business of islets and Langerhans, and improve their function. And one more, usually they given a treatment in the form of massage. She published, when you do massage also, there is a regulation of the stress hormone, permitting the body to use insulin more effectively. Mud therapy, normally we give cold abdominal pack, cold mud therapy or full mud bath, which is there in our protocol. So mud therapy also they have conducted a study. In 2019 one paper is published by Rukmini Nair et al. That mud application to abdomen increases the peripheral circulation, metabolic rate, and helps to reduce blood glucose level. Similarly, different packs. When we give different packs for diabetes, like cold abdominal pack, we tell them to continue in home. When we give like that, the immediate effect of cold abdominal pack on blood glucose level and cardiovascular functions in patients with type 2 diabetes mellitus. That again, Dr. Mununtan, our Co-Vice Chancellor of Visvasa University, Dr. N.K. Manjunath, they were all the authors of the paper, Journal of Clinical and Diagnostic Research in 2018. They found that insulin sensitivity increases and insulin that is very good for activation and controlling the blood sugar level. Similarly, the immediate effect of hypoglycemic effect of two selective hydrotherapeutic procedures in non-insulin dependent diabetes patients. Dean of Naturopathy, Dr. Sujata, she has published a paper in a Journal of Research Education India in 2014. Neutral dose and GH-PAT can play an important role in lowering the raised blood glucose level in non-insulin diabetes patients. So, even massage therapy also. Massage therapy is also very effective. When we give them a partial massage or full massage as a protocol for diabetes patients, because it is also because massage improves the glycemic control in women with type 2 diabetes mellitus. Again in 2004 they published, there is an immense improvement because balancing the hypothalamo-pituitary adrenal axis, through that there will be a balance and reduction in the HbA1c. That is a 3 months glucose level. 3 months diabetes is assessed to the glycosylated hemoglobin level. That is improved. Similarly, Swedish massage also proved that it will be very good for controlling our balancing our stress, reducing our anxiety, and balancing hypothalamo-pituitary adrenal axis, and through that there is a better controlling of the blood sugar level. So like this we have a number of papers to suggest that diabetic patients post-diabetic effects, they have a residual effect, especially diabetic foot, or there may be joint pain, or there may be restriction in their joint movement, that can prevented by diabetes. And next important is diet therapy. So we have given them a yoga therapy, proved with the scientific evidences. Why we selected that module? We have given them the evidence-based diabetes mellitus naturopathic treatment. Now the diet, you can see the AGCM Asgard juice. All about 5 days we have given them a patient alternatively. 2 days Asgard juice, then Bittergourd juice, then 2 days Asgard juice, Bittergourd juice, Asgard juice. The combination we have given. Ragi ganji we have given, special boiled diet we have given them. Nolkol juice we have given, plantain pith juice we have given. These all we have given them, even at 4 o'clock, cucumber sprouts, then boiled vegetable, initially first day, then all the 9 days raw, 8 days raw vegetables, and then 10th day the normal boiled vegetables. So there is a reason, even night we have given them a special because apple, because patient may go for hypoglycemic attacks. So here there is a big evidences to say that why Asgard and Bittergourd juice is given for diabetes patients. Why we have selected that when we prepared a protocol in our Center of Excellence for diabetes mellitus, type 2 diabetes mellitus. Here there is an evidence to say that during it published in Journal of Traditional and Complementary Medicine 2017, the immediate effect of Bittergourd, Asgard, Nolkol juices on blood sugar level, a patient with type 2 diabetes. Here they say the flavonoids which is present in Asgard juice stimulates the lipogenesis, glucose-transporting adenocytes, so adipocytes, so that it is very helpful for reducing the blood sugar level. Similar effect is brought down even in Nolkol juice also. That's why it is very usefully preventable as a good treatment for diabetes mellitus. We have given them Asgard juice, Nolkol juice, and Bittergourd juice diabetic patients. And again the Bittergourd juice also. That also the stomach emptying will be increasing, glucose absorption will decrease, and insulin sensitivity increases by giving Bittergourd juice. To published in 2018 one paper to say that it is one of the best pre-diabetic to give Bittergourd juice to the patients who are suffering from diabetes mellitus. Ragi ganji, even they found that health benefit of ragi ganji. So ganji they are given. It is one of the best food we are giving at 9 o'clock. There is a paper published on health benefits of finger millet. So that is very good because it is also compared to other phenolates which is present in the ragi, shows a very good effect for diabetic patients, and there is a wonderful result they will get when absorption is delayed, and if it is also energy it will give, but blood sugar level will never increase. So even cucumber in diabetes, role of cucumber in diabetes mellitus also, there is also a protective mechanism, and that also proved to be delaying the stomach emptying time, absorption. There is no rise of blood immediately, and inhibit the many reactions which is occurring at the cellular level, at the molecular level, and that will be very effective for prescribing to the diabetes patient. So overall, to conclude this, presentation as well as the results. So we have taken them 10 days, then the blood sugar third month, 6 months and 9 months. The results in total we are under analysis now. So we are not going to announce, maybe shortly we may publish that paper regarding 10 days what happened in diabetes mellitus, in third month what happened, 6 months, 9 months. But in total we found that there is a very good result in blood glucose level, decrease in insulin resistance, reduced body fat, lipid profile, but the prolonged treatment effect to be yet to be analyzed. So that's why we can conclude that these type of modalities, the natural modalities, because it is very important. The confidence while treating the community, which is a student community, to become a clinician tomorrow. You should be aware that when we prescribe any module, should have very proper scientific base. Is there any previous research is conducted? Or we have to set a goal that when we treated diabetes patients, what type of modalities were given? Because on the base of my 27 years clinical experience, I openly say that in diabetic patients there is a lot of benefit from by naturopathy and yoga. So I have seen patients who are walking for 5 to 6 kilometers, but blood glucose level never comes down. The moment they practice yoga, the moment their lifestyle change, second day itself there is a drastic change in their blood glucose level. So that it clearly proves that it's lifestyle related disorder. It is a stress induced element. So that is why the long run analysis is going on now to find how it is effective, and along with that it is a very simple cost effective treatment, naturopathy and yoga treatment. When we give them at our center in a different manner, but follow up will be very easy. Daily they have to follow, practice yoga, and then some of the diet measures, as well as they can lead their life very effectively. Because many times what happens is that people come with the smaller one medicines, two medicines, then insulin, because their dosage is increases because disease is progressive and age is also progressive. So that's why this type of treatment helps them to, even not only this study says that blood sugar reduces, but along with that cardiovascular risk in diabetes also reduces. So that's why it is to conclude that yoga therapy module, naturopathic module, diet module is an effective treatment, cost effective treatment, effective treatment for diabetes mellitus. Thank you.
Thank you, sir, for the insightful words. We have questions from the audience.
You can leave them. ಬಿಡ್ಬೋದು ಅವ್ರನ್ನ ಹೊರಗೆ ಬರ್ರಿ. ಅಲ್ಲ ಇಲ್ಲಿ ಇರಲಿ, ಇದಾದ್ರೆ ನೀವು ಇನ್ನೊಂದು ಸೆಕ್ಷನ್ ಬಾರಿಬೋದು, ಲಾಂಗ್ ಇದೆ, 1 hour.
Om Shri Manjunataya Namaha. Good afternoon, everyone. Once again, I welcome you to the International Webinar on Efficacy of Yoga and Naturopathy on Lifestyle and Metabolic Disorders. I'm Sathvi from SDMC NYS. Today I'm here to introduce you to our last speaker of today's session, Dr. Polika Nanjappa Manjunath. Dr. C.N. Manjunath is a senior cardiologist and director of Sri Jayadeva Institute of Cardiovascular Science and Research. Under his leadership, Sri Jayadeva Institute of Cardiovascular Science and Research have treated thousands of poor patients with a cardiac disease. He has performed more than 26,000 cardiac interventions, including coronary and non-coronary cases. He has innovated a new technique of performing balloon mitral valvuloplasty, being called Manjunath, which is published in the American Journal. He has done highest number of balloon mitral valvuloplasty with Aurora balloon in India, which is published in the Journal of Interventional Cardiology. Left atrial thrombus classification is called Manjunath's classification, which is published in Physician and Cardiovascular Interventions. He has more than 125 publications in international journals. He has a teaching experience of more than 30 years with more than 34 years of experience in medical. He is the author and architect of the Hriday Sanjeevani scheme for the poor. Recognizing his professional philanthropy and social commitment, he was awarded with the fourth highest civilian honor of Padma Shri by Government of India in 2007. He is a recipient of Rajyotsava Prashasti, the second highest civilian award of Government of Karnataka, and with the degree of doctorate by RGHS and Karnataka State Open University, and to name many more. Now, we are looking forward to hear this. Over to you.
ಅದನ್ನೇ ಆನ್ ಮಾಡಿ ಅದು ಹಾಕಿದ್ರಾ ಸ್ಪೀಕರ್ ಇಲ್ಲ ಅಂದ್ರೆ ಯಾಕೆ ಹಾಕಕ್ಕೋದ್ರಿ ಹಲೋ Hello? Hello, can you hear us? Hello?
Yes, sir. Yes, sir.
Hello? Hello, Dr. Prashant, can you ಕೇಳಿಸ್ತಾ ಇದೆಯಾ? ಹಲೋ
ಹಲೋ ಸರ್.
ಹಲೋ ಕೇಳಿಸ್ತಾ ಇದೆಯಾ?
ಕೇಳಿಸಿದೆ ಸರ್.
ಅಲ್ಲ ಕ್ಲಿಯರ್ ಆಗಿ ಕೇಳಿಸ್ತಾ ಇದೆಯಾ?
ಕೇಳಿಸಿದೆ, ಕ್ಲಿಯರ್ ಆಗಿ ಕೇಳಿಸಿದೆ.
Okay, sorry, I was held up in the cath lab. So unfortunately, I have to join all of you a little late for this seminar on this yoga Mahotsav day. Thank you very much for your invitation for delivering this particular talk on the safe efficacy of yoga on various lifestyle diseases and metabolic diseases. So today, probably you have to bear with me because I am joining you late by half an hour. So is it clear, sir? Hello?
Yes, sir. Yes, sir.
Okay, okay.
ಕೇಳ್ತಿದೆ sir.
So let me start with a heart itself. You know that normal heart is just the size of your face, and but tremendously it has to do a lot of stressful job because daily it has to beat at a rate of say 1 lakh beats per minute, and it has to pump around 6,000 liters of blood daily. So absolutely there is no rest for the heart. So it is one of the most important component of our lifestyle diseases. So if you look at this list of lifestyle diseases, number 1 is cardiovascular disease, second is high blood pressure, third is diabetes mellitus, fourth is stroke, fifth is cancer. Now the latest addition to the list of this lifestyle disease is digitalization and screen addiction, and also another new entity has been added, what is called loneliness syndrome. So these are some of the 6 important lifestyle diseases. So this is where lifestyle modification is very much required, a healthy lifestyle, and all our other activities such as physical activity, including yoga, has got a tremendous positive impact on reduction of the burden of all these lifestyle diseases. So if you look at the top 10 causes of mortality, you just compare 2008 versus 2030, there is no much significant change. The cardiovascular disease continues to be the number 1 killer, and cancer is second, chronic respiratory disease, and diabetes mellitus has moved actually from its lower position to higher position. So if you look at the trend of all these diseases, of course, now we have what is called the various risk factors. We have 2 types of risk factors. One is non-modifiable risk factors. Second is modifiable risk factors. Non-modifiable risk factors you cannot change actually. Age you cannot change. So age more than 45 in India is an independent risk factor for coronary artery disease or heart attack related disease. And in women, age more than 55. If you go back to 30 years, at that point of time, the age more than 65 used to be the independent risk factor for heart attack in men. So with every decade, the age at which heart diseases, particularly coronary artery disease, is occurring at an younger age group in India compared to the Western population. And there was a time we used to believe, and it was true, that premenopausal women are protected from coronary artery disease. But unfortunately, with the changing lifestyle and also because of various stress that are operating even in women, so 8 to 10% of heart attack in India today below 50 years, that is in the premenopausal age group, are also suffering from heart attack, which is a matter of great concern. Earlier, premenopausal women, we never used to see heart attack. Today, even premenopausal women are also becoming victims of heart attack because today many women are working like men. We call it as what we call it as menish women, except for reproductive cycles. They almost work like men, and also all problems of the family are also deposited in women, whether it is a family stress, whether it is the children education stress, or our own workplace stress, are all deposited in a bank called women. So as a result, women are also becoming vulnerable to all lifestyle diseases, including heart attack, diabetes, as well as high blood pressure. And family history is also important. Of course, this is one thing we can't really change. In our own study, 15% who suffer heart attack in younger age group have a strong family history of a premature heart attack. Suppose if somebody in the family dies of heart attack or suffer from heart attack before the age of 55, it is considered as a strong family history. So this is all non-modifiable risk factors. You can't change age, you can't change sex, you can't change, and genetics also you cannot change. Then coming to modifiable risk factors for heart attack, smoking unquestionably is number one risk factor. In our own study, nearly 55% of patients with coronary artery disease are smokers. Smoking, in fact, is more in village, rural areas than in urban areas. Then diabetes mellitus is also an important risk factor. India is a capital of diabetes mellitus. It's a capital of heart attack. It is a capital of high blood pressure. And for all wrong reasons, India has taken a top position as far as these lifestyle diseases are concerned. As far as India is concerned, nearly 70 million people are suffering from diabetes. Another 70 million are on the threshold of diabetes mellitus. So as a result, diabetes is one of the important risk factor for coronary artery disease and also for high blood pressure and chronic kidney disease. And yes, everything in India occurs about 10 to 15 years earlier compared to the Western population. Diabetes we see, even heart attack we see among the potential bridegrooms, even in college going students, even in just in the age group of 25 to 30. So all these diseases are quite premature in India. Then other risk factors is elevated cholesterol. There is a strong correlation between cholesterol and heart attack. For every 1% increase in cholesterol, there is 2% increase in the prevalence of coronary artery disease. There is a strong, misbelief, I can say, there is a misconception or a misbelief that only obese people have high cholesterol and thin individuals or underweight individuals do not have high cholesterol. It is a wrong notion. Even those with low body weight or underweight or thin individuals can also have high cholesterol. One should not be under the impression that cholesterol is high only among obese people. Then high blood pressure, yes, this is another lifestyle disease. Nearly 1 in 4 after the age of 50 or 60 years in India are having high blood pressure. Then obesity is also an important entity or a risk factor for heart problem in India. See, in India, there is another obesity, what is called central obesity. It is also called thin fat individual. What is called, their body weight is more or less normal, but have a central obesity. So this is what is called thin fat individual. And this is also a risk factor, particularly these people will have heart problem, they will have diabetes, they will have high blood pressure, high cholesterol. Then lack of exercise. This is where the importance of physical activity, importance of yoga is likely to play a significant role. According to ICMR data, nearly 55% of Indians have decreased physical activity, and definitely exercise has got an important role to play. We all know that minimum recommended duration of exercise is at least 45 to 50 minutes per day. That increases your lifespan for nearly 8 to 10 years. So again, I will come back to the yoga a little later in the course of my discussion. And type A personality. What is type A personality? Type A personality means these people are extremely arrogant, egoistic, and also eccentric, sadistic. They don't like the growth of others. They don't really appreciate the good qualities of the other or the good work of others. As a result, these people, not only they suffer from heart attack or high blood pressure, they also are responsible for occurrence of heart attack and high blood pressure in those, in people working around them. So and anger. See, the first victim of anger is yourself. I think that is the reason people with anger are more prone for blood pressure, more prone for heart attack related disease. Anger is danger. That's the reason we say worry, curry, hurry. These things are responsible for lifestyle disease. Hurry, people nowadays, all our younger generation in a hurry. They want to achieve too many things in a too short time. Everything should happen with less activity, and everything should happen with first attempt itself. So, and that's the reason hurry, worry, hurry. These are the other important risk factors for this lifestyle disease. Alcohol in excess. See, although there are some reports, alcohol in moderation is good for the heart, but unfortunately, as doctors, we cannot give alcohol as a prescription, because alcohol definitely in higher doses increases your heart rate, increases in your blood pressure. It also increases the prevalence of heart attack. Even when we advise alcohol, you have to take in small doses. The patients and people conveniently forget the dose doctor has mentioned, but they remember very well the doctor did say that you can consume little bit of alcohol. That is the reason we never give alcohol as a prescription, because they remember only alcohol, but they forget the dose the doctor has mentioned. So alcohol is also, just on a lighter note, alcohol is also a device which converts actually the silence into speech, and this is the other humoral aspect of alcohol. Then stress is the very, very important risk factor. What is the definition of stress? Stress is nothing but the gap between your expectations and performance. Your expectations are more than the performance, that result in stress. Today, this is a real, risk factor for young and middle-aged, in all walks of life. Today, there is a stress. Students have their study stress, and also the people between 20 and 30, they have a career stress, then they have a family stress, they have a professional stress. So stress management is extremely important. This is where yoga and meditation will have a tremendous role to play. Another important thing I wanted to stress here, there is a very good correlation between your heart rate and the cardiovascular risk. People with higher heart rate, they will have a higher cardiovascular risk, and also people with a higher heart rate will have a reduced mortality. This is a very clear correlation between your higher heart rate and this lifestyle disease, particularly heart attack related disease. Just to give an example, for example, higher the heart rate, lesser will be the lifespan. As all of you know, the normal heart rate under basal conditions is somewhere between 70 to 75 beats per minute. Heart rate is between 70 to 75 beats per minute, and with anxiety and stress, it can go up to 80 or 90. So you take, for example, tortoise. Tortoise has a heart rate of only about 35 to 40 per minute, and the lifespan of tortoise is almost 100 years. They live for 100, 200 years. In fact, we have seen tortoise in the literature living for 250 years. So lower the heart rate, your lifespan will be longer. And you take some tennis players, they exercise, they play, exert nearly 3 to 4 hours or 5 hours during their practice, and their heart rate is also around 40 to 45. And of course, this is a normal pattern heart rate I am talking about. If it is abnormally low, then it is bad. If the normal pattern, if the heart rate is lesser, lifespan is longer. You take birds, for example. The birds will have a heart rate of somewhere around 250 to 300 beats per minute. The lifespan of a bird is shorter. So that is the reason with exercise, with yoga, what happens with yoga, there is a reduced sympathetic activity. So there are three basic mechanisms by which the yoga reduces your stress, and also it reduces your heart rate. It reduces to some extent the blood pressure, and also reduces the stress on the arteries and the various vessel walls. Because with proper meditation, with proper way, of course, I will not get into various asanas and all, because you are all well versed with that. I'm only talking about the impact of exercise, whether it is running, whether it is walking, whether it is swimming. These are the best exercises, what is called isotonic exercises. That is walking, cycling, jogging, or even for that matter, swimming. These are all good exercises, and yoga is a little different from that. It's a beautiful combination of both physical activity and also the mental. It's yoga is a beautiful combination of both a physical exercise and also a mental cooling effect. So that is where it has got an additional benefit. And with this exercise and yoga, definitely it reduces your sympathetic tone. It reduces your all stress hormones such as adrenaline, noradrenaline. As a result, your heart rate will be less among those people who does very systematic programmed yogic exercise. And even neurohormonal changes also happens with yoga. And the third one is it increases the vagal tone. So on one side, it decreases sympathetic activity. As a result, all stress hormones levels will come down. It also increases the vagal tone. So combination of decreased sympathetic activity, increase in the vagal tone, definitely reduces your heart rate. It reduces your blood pressure, and also it reduces the cholesterol. Particularly, it reduces your LDL cholesterol. So all ultimately results in reduction of blood pressure, reduction of your cardiovascular risk. So these are some of the tremendous advantages of yogic exercises, because yoga combines, it actually promotes physical, mental, spiritual, and social health. So even the WHO definition of health is it is a state of physical, mental, social, and spiritual well-being. So all in one basket, the yoga provides a significant impact on all these aspects of lifestyle diseases. So another important thing I wanted to emphasize is the joint families. The impact of joint families now becoming reduced over a period of time. So earlier, just to give an example, in 1960 and before, entire brothers, sisters, grandparents, everybody used to live together. See, a family was full of happiness, full of love, affection, and the work was distributed among most of the family members. So family itself used to be a kindergarten school. Family itself used to be a community center, and each one was doing a separate, different work. As a result, the work was distributed, and it was full of happiness and contentment. That was the reason why these lifestyle diseases and the metabolic disorders were very rare, maybe about 60 years back. Then as we moved from 1960 Slides are not coming.
It's coming, sir. Yes, sir. Slides are visible.
Can you able to see my slides?
Yes, sir. Yes, sir. Now it's visible, sir.
Okay, okay. No, I'm just talking about the importance of joint family and also its positive impact on the lifestyle diseases. So then in 1980, the family size was getting squeezed, but still it was a quite a healthy family. Now you look at 2020. So the definition of joint family in 2020 2022 is husband and wife living together is a joint family, unfortunately. So you just see in this picture, each one is looking into their mobile phone, and there is, although there is a physical contact, virtually they are not socially together, they are not mentally together, they are not spiritually together. So this is the reason why young and middle-aged Indians, or even in the other part of the world, are becoming vulnerable to lifestyle disease. Now we have what is called a screen addiction, and also there is an entity called a sitting disease. See, screen addiction, nearly 15 to 20% of Indians today are glued to their screen, whether it is computers, whether it is iPad, or whether it is tab or mobile phone, or your various components of your mobile social media. So by repeatedly logging on to all this screen, so that causes, loneliness. See, loneliness is not because there are, they are alone. Even if today, if there are 10 people sitting, what is happening? Each one is looking into their mobile phone. Each one is looking into their mobile phone and not talking to each other. In fact, that this is called loneliness, and all these have got an adverse impact on this lifestyle disease, whether it is high blood pressure or diabetes. So because earlier the people used to talk, and there used to be they used to talk about their family matter, they used to talk about their neighborhood, and so today we are talking about moon, we are talking about Mars, but we don't know much about our own neighborhood. So I think screen addiction and loneliness is one of the unfortunate gift given by this digitalization or digital world. So screen addiction, because I think moment they are glued to the TV, what happens? There is no body movement, and also that screen brightness also have a negative impact on the eyesight, all those things, and it increases your stress levels. So screen addiction and loneliness, and of course in India, a lot of ladies are very much keen on watching these TV serials for hours and hours. You believe me, some of these TV serials will never end in this generation. They go on saying 500 episodes, 600 episodes. Then we have what is called sitting disease. That means if you are sitting in one place for more than 3 to 4 hours, it is equal to smoking 4 to 5 cigarettes. So this is also a modern sedentary lifestyle, both at home, in workplace, are costly for us and for our employees. You look at the impact of sitting. What research report says, sitting more than 6 hours a day decreases the lifespan of men by 20% and decreases the lifespan of women by 40%. And also these are all relative. 21% increase in breast cancer, 27% increase in diabetes. And that is the reason. Even standing is an exercise. So if you are actually sitting even for 1 or 2 hours, at least in between, you just walk for, or just move around for at least 10-15 minutes, so that you will not get into this sitting disease syndrome. And there is 25% increase in digestive tract cancer. So these are some of these ill effects of sitting for a longer time. So this is what the trend is. See, earlier our farmers and all our people used to work hard in the field, and you can see here they were all working for food actually. So in the lower panel, you see here they are running on the treadmill to digest the food. So the upper panel, they want to earn the bread. Here they want to burn the bread. That is in the below panel. So coming to heart attack, nearly 25% of deaths in India, 25% of deaths in India is due to heart attack. Unfortunately, another worrying factor is 30% who develop heart attack in India are below 40 years of age. See, we have seen heart attack patients as young as 16 years, as young as 21 years, 22 years, medical graduates, 22 years, engineering graduates, and 20-year-old street vendor. So there was a time it was believed that heart attack is basically a disease of urbanites and a disease of elite class. No, today it is equally prevalent among the rural class. It's also equally prevalent among the labor class and also in women. Yes, initially I've already said earlier, maybe 4 decades back, there was we rarely used to see a heart attack in premenopausal women. Today, nearly 8% of heart attack, 8 to 10% of heart attack is seen even in premenopausal women. So because of stress, because of diabetes, because of physical inactivity, and children education is also putting a lot of stress on the mothers, because today children education is mother's examination. So this is how the cholesterol accumulates. Of course, today for all this blockage of the arteries in the heart, we do angioplasty. And this is how stents are inserted. These are all either inserted through the leg artery or through the arteries of the upper limb. Stainless steel mesh. So this is just a pictorial thing showing how angioplasty is done. You can see these yellow things is the cholesterol deposition, and a balloon is inserted, and on the balloon is the stent. When the balloon inflates, the stent comes out and sticks to the vessel wall. Then we deflate the balloon and takes it out. So this is just to show how the blockage looks here. You can see in the mid portion, these are the arteries which carry the oxygen and the blood to the heart muscle. If there is a blockage, then they develop what is called angina initially, then it lands up in heart attack. Here is a patient had a 90% critical block in the mid portion. So on the left panel, you can see this is balloon inserted under the cath lab guidance, and that blockage. So on the right panel, you can see the vessel is, the blockage is cleared and stent is inserted. So this is basically what you call it as a treadmill. So many times, so you can ask me, is it possible to identify? Is it possible to identify heart attack, whether person is going to develop heart problem much before developing, well in advance, whether it is possible? So we always do a treadmill ECG where we make them run on treadmill ECG and take ECGs. And if treadmill ECG is normal, then chances of having getting heart attack in future is less. So because the burden of cardiovascular disease is very high in India, so we recommend men above 35, women above 45 should undergo a medical checkup anniversary. See, we all celebrate anniversary, we all celebrate birthdays. So best is men above 35 and women above 45 should undergo a medical checkup anniversary. That includes blood sugar, that includes blood cholesterol check, blood sugar, blood cholesterol, and also a treadmill ECG. That will definitely will tell us whether person is under low risk or a high risk. Then again, the diet is extremely important. You should have more fruits, more vegetables, less of fat. You can have more pulses. And again, the meat, red meat should be avoided. If they are some non-vegetarian, they should always take chicken and fish. But most important, you should avoid the animal fat or a saturated fat. You should avoid, and more of fruits and vegetables. So this exercise I already said. So lifestyle change, this is recently demo 4 healthy lifestyle smoking cessation. This is the best intervention that can reduce cardiovascular disease, and also of course smoking has many other hazards like lung cancer and all those things, and regular exercise, weight control, and all decrease your coronary artery disease by 80%. See, you should avoid 5 S. You should take care of 5 S. That is, one is salt, second is stress, third is smoking, fourth is spirit, fifth is sedentary lifestyle. So these 5 S you should take care. Then probably you can really reduce and you can stay healthy. That's the reason we are showing here. This is blood pressure 120/80. Normal blood pressure can be up to 130/85 or maybe up to 140/85. Anything above that, it is considered high blood pressure. And blood sugar is fasting, as we all know that it is between 100 to 120 or 25. Then random blood sugar, anything above 200 is considered diabetic. So this is one. I am just showing some pictures. I think all this stuff one should avoid. Very, very important. See, here we have these burgers, and here we have French fries. So that's the reason those 5 S, we should, all 5 S are here actually. Salt is there. Then we have the, of course, she's not having the cigar, and she has, this is some drink. Then cholesterol, all those things are there. So another important thing for your healthy heart, for maintaining a very good heart health, you have to keep 5 things as low as possible. You have to keep 5 things as low as possible. So lower is better. We say lower is better. Keep these 5 things as low as possible. One is blood pressure. Second is blood sugar. Third is blood cholesterol. Fourth is body weight and this waist circumference. Fifth is overambition, overambition, overambition. So avoid. So this is just to show. That's what I was telling. I mean, absolutely sedentary, lazy life, and this as a woman body was never designed for a sedentary lifestyle. It was created to actually to active, to move, and to walk and to work. So this is a regular exercise. So I've already said the importance of regular, because it really regulates your heart rate, it regulates your blood pressure. Yoga is a beautiful combination of, because it blends both physical, mental, and spiritual aspects of exercise. So this is the health benefits of physical activity: increases longevity, better quality of life, more energy, weight management, and improves the mood and the sleep better. Diabetes management is better. If somebody is diabetic, if they do exercise, then their requirement of insulin, requirement of tablets might come down, and lower risk of many chronic diseases, and also blood pressure. In fact, with very good yoga program, your blood pressure, systolic blood pressure comes down by 10 to 12 millimeters. Diastolic blood pressure comes down by 8 to 10 millimeters. It lowers the stress, and also it overcomes depression, anxiety, and reduces cholesterol and other abnormal lipids. So look at this life expectancy with physical activity, years of life gain. So with a better exercise, you actually gain more years, more, your life expectancy is a lot better with physical activity. Avoid unhealthy food, the energy drinks and all those aerated drinks you should reduce or you should avoid. In fact, there are 6 best cosmetics in life. 5 or 6 best cosmetics in life. Cosmetics is not the either the makeup items I am talking about. The 6 best healthy cosmetics. Number 1, that is sympathy for the eyes and prayers for the lips, smile for the face, meditation for the mind, yoga for the body. So these are the best 6 cosmetics one should always think. And yes, smile is in fact, there are also 5 to 6 doctors in nature. What are those 5 to 6 best doctors in nature? One is sunlight, second is diet, third is rest, fourth is exercise, fifth is friendship, and sixth is yoga. So this is because sunlight, when it falls on the skin, it produces vitamin D. It's very important. And diet I've already described. Even the exercise I've briefed in detail. Then friendship. I think as we age, friendship has got a very good impact on your lifespan and also on your lifestyle. Friendship is nothing but a heartbeat. It may be invisible, but continuously supports. The age also, as we age, the importance of friendship increases, particularly after the age of 60, when some people retire. So that is the time we need a lot of friends. They provide emotional support. They also provide other assistance. So these are the best 6 cosmetics, and also they are the best doctors in nature. Again, I repeat: sunlight, diet, exercise, and smile as a friendship, as well as your yoga. Smile is the one thing we should always inculcate, because these are all small things makes a huge difference. See, and they are, fortunately, they are all free. Sunlight is free, exercise is free, smile is free, and friendship is free, and yoga also, yes, you can practice free. So all these, so nature has provided lot of great things. We are blessed to have lot of good things. Unfortunately, we are not valuing it. So smile is the best cosmetic, smile is the best jewelry, smile is the best antidepressant. And what is smile? Smile, seeing miracle in day-to-day life, that is also a smile. So I think it reduces stress. See, you might have seen when somebody whom you don't like, if they come and sit by your side, it increases your heart rate, it increases your blood pressure. You just smile, that reduces, that brings you people close to, close and close. So this is what we should eat: more of fruits, more of vegetables, and these are all rich in vitamin C, and also some of them are rich in calcium. And you should eat more of vegetable oils. You should eat of more nuts, seeds, eggs are okay, dairy milk, whole grains, legumes. Man of red. So yogic practice of meditation and are also beneficial. Long-term health of a person, society, or a nation cannot be brought by medical science alone. This is a very great statement, because medicines alone, operations alone cannot cure the disease or cannot give cannot promote an health. So a lot of lifestyle changes need to be understood. So you know how to live, how to eat, how to keep your body, how to keep your breath, how to keep your mind, and these are very, very important. So this is derived from Sanskrit word. Yoga means union of individual consciousness or soul with universal consciousness or spirit. So this is almost dates back to 500 years, and it was all earlier days. All our gurus, gurukulas were teaching us. Many think of only it's both a physical exercise. It's both a combination of both physical, mental, and spirit. These are actually the most superficial aspect of unfolding potentials of the human mind and soul. Yoga covers all aspects of human life, leads to physical well-being, mental harmony, positive thinking, happiness, and peace. It also detoxifies the body, mitigate chronic fatigue, enhance endurance, improves immune and organ function. These are some of the great advantages of yoga. Yes, we have many postures. I will not get into that. And so these are some of there are some important studies that have been taken. Yoga has been adopted for use in complementary alternative medicine in North America, Europe, so also in India. So there are some studies. It's also used as a therapeutic intervention. More than 13 million American adults, about half of American yoga practitioners. So these are some of the data we are coming up. So what is the effect of yoga on some of these cardiovascular risk indices? It reduces insulin resistance, it improves your cholesterol profile, and it reduces blood pressure, and also it reduces the oxygen demand of the body. This I already said. See, 100 type 2 diabetes mellitus with high cholesterol were randomized to control and yoga group. And yes, there were also other, of course, one group was taking only diabetic medicine, another group was taking diabetic medicine plus practicing yoga. So yoga, then they looked at 1 hour, the cholesterol levels were studied. So also blood pressure was studied between those two groups. And the group which was doing both yoga as well as taking the diabetic medicine did better. There is nearly 5.8 to 25% decrease in total cholesterol, 22 to 28% decrease in triglycerides, and 12.8 to 26% reduction in LDL cholesterol. So that means whatever medicines you are taking, if you combine your medicines or combine your interventions along with yoga, it has got a value addition. It will have additional benefits. So that is what the yoga does to your health as well as to your metabolic diseases. And there is nearly 1.5 to 13% reduction in body weight. So mechanism of benefit cannot be explained by simple exercise, since practice asana does not bring about increased rapid large muscle activity, but definitely it reduces the sympathetic drive, it increases the vagal tone, it also reduces the neurohormonal aspects. And psychosocial stress is a significant predictor of high blood pressure, stroke, heart attack. So several studies have suggested that yoga definitely reduces your psychosocial stress. Yoga can also be practiced for secondary prevention of coronary artery disease. So definitely the studies have shown that a very programmed and very systematic practicing yoga reduces the cholesterol deposits within the arteries. And of course, I am not telling yoga alone can be a cure for all this problem, but in addition to the treatment, in addition to the drugs, definitely addition of practicing yoga will provide additional benefits. So at 1 year, yoga group showed a significant reduction in number of chest pain episodes per week, and their 6 minutes walking capacity has increased, and there was decrease in body weight. So this is another study carried out in patients who have undergone angioplasty and bypass surgery. And so those patients, in addition to medicines, those who practiced yoga, there was a regression of cholesterol deposition and the blockage regression does take place. So this is a randomized control study, 250 male patients aged between 35 to 65, follow-up period is 1 year. This is funded by Ayush Ministry of Health, Government of India, and these are the results. There was improvement in the ejection fraction, that is improvement in the heart function or in the pumping capacity. There was reduction in the body mass index. There was also a reduction in blood sugar. There is a decrease in LDL, because LDL is a bad cholesterol, HDL is a good cholesterol. So with exercise, with yoga, there is improvement in good cholesterol, there is decrease in bad cholesterol. And also, yes, heart has got a current, heart also has got an electrical activity. That is the reason heart keeps on beating. So if sympathetic activity is more, heart beats faster, heart rate can go up to 200, 250, there can be a sudden death also. So by practicing yoga, the sympathetic activity is reduced and the vagal activity is improved. As a result, there is a reduction in abnormal heart rate pattern or arrhythmia, what we call. This atrial fibrillation means heartbeat is because of high blood pressure, diabetes, or heart problems, or heart attack, heartbeat can be irregular. So with yoga, the heartbeat irregularity was also to some extent got reduced. Of course, this is in addition to medication. So these are the possible mechanisms by which yoga and other exercise have got a positive influence on the heart and cardiovascular disease. Yoga triggers neurohormonal mechanisms. It reduces the sympathomimetic adrenal system. It also increases vagal tone. These are all various trials that have been published. Effects of yoga on cardiac rehabilitation program. This was done in our study, and Dr. Prabhavati, she is a professor of cardiology at Jayadeva. She has done this study. So this was, so that means patients who have undergone angioplasty, who have undergone bypass surgery, who have undergone treatment for heart disease were put on this particular program, and this cardiac rehabilitation. This includes diet counseling, psychosomatic counseling, and also coupled with yoga showed some benefit. So a cardiac rehabilitation program is very, very important. I have been kept on telling only operations or only medicines or only your angioplasty or stenting alone will, or medication, whether it is insulin or anti-diabetic drugs or cholesterol lowering drugs alone is not sufficient. We have to practice exercise. We have to practice healthy lifestyle. We have to also stress management. And unnecessarily, you should not get into anger. Inculcate a smile into your day-to-day life, and you should not get unnecessarily get stressed. You should not be impulsively. You should not act, because impulsive behavior, all of a sudden people keep shouting and keep arguing, because always we say argument is always bad, and most important, discussions. So discussions are better than arguments. Argument is basically found out who is wrong, and discussion is a combination, is basically of both your wisdom and also your courteousness. So argument is worst and discussion is always best. So that is how we should inculcate all these things in our lifestyle. So this is our protocol. So definitely there was a reduction in all these adverse events, particularly the smoking and yoga, cessation of smoking and practicing yoga. They showed a significant improvement in various metabolic parameters. So these are the things. Yes, you have to take care of obesity and avoid salt, avoid alcohol, and quit smoking. And you have to physically active, and you have to reduce your stress, and don't be, angry all the time. This is a randomized control trial of a multifactorial lifestyle intervention treated with antihypertensive drugs were randomized, and also, of course, the stress management was advised. So all these things, see, this is what, for sustaining the benefits of your surgery or your intervention, you have to practice an healthy lifestyle, and you have to inculcate exercise and also yoga. I think all this bottom line conclusion of all these trials are same. So these are the advantages of yoga. It is safe, no pain, lot of gain, no age restriction, and no side effects. Of course, as far as various asanas and aggressive, asanas are concerned, one has to tailor made for the age also. Because if somebody is 70 plus or 80 plus, then you should not have a very vigorous or a very high intensity yoga program, because all population does not fit into one basket. It has to be tailor made for that particular age, particular weight, all those things. So definitely these lifestyle diseases are on the rise because of modernization, because of industrialization, because of digitalization. And again, also another thing, air pollution is also another contributing factor, and stress levels are terrible because this is a competitive world. People want to achieve too many things in a too short time. You have to go step by step, and you have to also, you should also know how to handle stress and how to overcome failures. See, normally life is full of ups and downs. ECG is a typical example. If I think you have all seen ECGs, or definitely you are well aware of ECG. If you look at the ECG, the graphs go up and down, up and down. Some graphs go up, some graphs come down. That means person is alive, person is living. So that is the philosophy, and that is the law of nature. So if ECG is straight line, then that means person is no more. So that's how life is always full of ups and downs, and you should know how to handle all these things. And failure, there is nothing like a failure. Failure is nothing but first attempt in learning, and you should always take failure as the first step for your future progress. So that's how you should manage your life, and you should, whether it is allopathy, whether it is homeopathy, whether it is naturopathy, have sympathy for the patients. Thank you very much. In Banta. Hello.
Sir, there is a question for the audience. After medical intervention, from what age can yoga be started for the patients?
Dr. Prashant, I am done. ಅಲ್ಲೇ ಬರ್ತಾನೆ ಅದಾದ್ರೆ ಇದು ಬೇಕಾಗಿ.
It's a question from the audience. After medical intervention, from what time period can yoga be started for the patients?
Hello.
Sir,
Hello. There is a lot of disturbance, madam.
Sir, there is a question from the audience. After medical intervention, from what time period can yoga be started for the patients?
See, if it is, before starting yoga, one should have, of course, a proper cardiac assessment, and yoga therapist should be aware of what is the cardiac condition. Suppose if heart function is normal, if it is more than 40%, if there is no chest pain, and if it is surgery, probably they have to wait for at least about 2 months if it is a surgery. Suppose if it is an angioplasty and all, they can take it even after 1 month of undergoing an angioplasty. If it is surgery, because they have a sternal pain, they will have incision, sternal wound will be still quite raw. As a result, if it is surgery, better you wait for 2 to 3 months. So of course, they can always do walking and other things. But as far as and simple breathing exercise can be done as early as even 3 to 4 weeks of surgery. In fact, breathing exercise we start even in the hospital itself. So, but regarding asanas and all, one has to wait for at least 2 to 3 months. So that's how we should split your yoga program.
Thank you, sir. There's one more question. Sir, why heart attack is seen more in premenopausal women?
No, not. I'm not telling heart attack is more in premenopausal women. No. Heart attack was very rare earlier, maybe 3 to 4 decades back in premenopausal women. Now we have started seeing a little increase, but still heart attack is more common in men than women. But compared to what it was 3 decades back, now it is little more among premenopausal women, because we see more diabetes in premenopausal women, obesity, stress levels are more, and also they are also working like men. And sometimes artificial menopause also we see a lot of ladies are undergoing even at the age of 30, 35, this hysterectomy. So that is also an artificial menopause. So those are some of the reasons.
Thank you, sir.
Om Sri Manjunathaya Namaha. Sir, Dr. Prashant speaking. Dr. C.N. Manjunath, you know all of you, his capacity, his strength and strength in the heart. Because even C.N. Manjunath's voice, heart will come proper. So like that people are there. Because that many people are behind him. I know from his last 20 years, I know he's a very simple and very sympathetic to all the people of the country. And Jayadeva Hospital, once health minister went, he was asking his PA whether this Jayadeva is private or the status of the hospital is like private life, because all that arrangement is made, and it is only because of his love towards the patient. It is the only love helped him to reach to that level. So today, with busy schedule, once I requested him over the phone yesterday, he is happily agreed to come, and he wanted to address all of you. And one more thing is, our PG students, he allowed them to study 1 month cardiology under him. So these are things, always, he is he is a good friend of, good advisor to our president also, and he is a devotee of Lord Manjunatha. Every time he comes here, and he takes, one day he stays, and he takes the good darshan and talk to our Henryji and goes back. This was his custom always. So, and all the patients treated under him, they are all well treated, and nobody who goes there, no treatment, that question is not there in the 24 hours. This all made him to made his all this cardiac department is very popular all over not only India, in South Asia also is very famous. So we are congratulate him for all his activities in his life.
Thank you.
All the best, sir.
Dr. Prashant, actually, when you called yesterday, when you called me yesterday, because I was actually talking to some patient, I was busy. I was thinking I have to join this program as a participant. I never thought I should give a lecture. Then all of a sudden, my secretary told around 3:30, sir, you have to speak. Then I have to jumble all slides and I have to get, spontaneously prepared for the talk. Otherwise, I was thinking I have to participate as a participant, and I was, I was somewhere I missed that I have to be a speaker. Anyway, it's fine.
Thank you so much, sir, for acknowledging us with your immense knowledge, which has enlightened us. Your service and dedication is truly an inspiration for all of us. Once again, on behalf of our management and entire SDMC and Wise family, a heartfelt thank you, sir.
Thank you. ಆಯ್ತಲ್ಲ?
ಮೈಕ್ ಇಟ್ಕೊಂಡ್ಬಿಡಿ.